Welcome back, everyone. Today we are here with Ms. Jennifer Murphy, who is the Director of the Health Department here in Winchester, MA. So without further ado, Ms. Murphy, could you please provide a brief introduction about yourself?
Hi, yes. I am Jennifer Murphy and I work at the Health Department in Winchester. I've been here for 16 years. Prior to that, I was working for the State Department of Public Health. I worked for many years at the Childhood Lead Poisoning Prevention Program, as well as the Department of Community Sanitation. And my job varied quite a bit, but I did cover some of the same topics at the state as I do here at a local level, dealing with a lot of the same regulations. So I was familiar with what I had to enforce and uphold prior to coming to Winchester, but this job is certainly a lot more varied, that's for
Yeah.
certain.
Um, so what have been the biggest challenges that you've faced over the past few months during this pandemic?
Oh my goodness. So this is the first time in over 100 years that we've faced a pandemic. So everything has been, or many things have been new to me, as they have been, for everyone. And there've been many challenges along the way, but I would say one of the greatest has been sort of a lack of coordination that we've seen at the federal level, and it has also been at the outset at the state level as well. The failure of advance notice, concrete guidance, data, tools, and resources had made our job at the local level a bit difficult. And thankfully, as a local public health department, we have dedicated nurses that have helped us throughout the way with contact tracing and case identification. And we've proactively developed and shared risk communications, but there are still limited tools to address COVID, like a vaccine or therapeutics, which is really making our job a lot harder all around. And as we know, testing remains a challenge. There's confusion over the types of testing out there, and not all tests are created equal. But to help kind of guide residents, we do have on our town webpage, the coronavirus webpage, information about testing that I encourage people to read. And then the governor has extended free testing sites, which is great for people to go to get a PCR test, which is the gold standard of tests that people want to get out there. So it's free and it's a PCR test. So MA Stop the Spread is a great place to go, but also to the town website. But I'd say also one of our greatest failings as a country has been around nursing homes and assisted living facilities. And at the outset of coronavirus, it was a little bit heartbreaking to see that, to see those failings in action. In other words, people becoming ill, and in fact, some people passing away from it. So again, I attribute our work with our public health nurses, their work with the nursing homes to try to prevent and try to prevent that as much as possible within the nursing homes and the assisted living facilities to try to be protective of our most vulnerable population. Right. But anyway, overall, despite the challenges and hurdles in this really uncharted territory, Winchester has been effectively managing COVID, and we appreciate the hard work of everybody in town, from our town officials to the residents.
Right, and I couldn't agree with that statement more. So does having a hospital in our town, does that impact the decision making and the policy choices when handling outbreaks such as COVID-19?
It's certainly an asset. Even pre-COVID, having a hospital in our community is certainly an asset, because we collaborated with them often on things from, substance abuse prevention, for example, which we continue to do. But in terms of COVID, having the hospital close by, it's a valuable asset to have in terms of, if we look at another data point, for example, around COVID, they share data with us about their capacity in their ICU and so forth. So that's helpful, I think, in terms of tracking COVID. And if we had an urgent need, for example, around funding or so forth, they've been awfully generous in terms of their community benefits for us in trying to promote certain things, like, for example, our mental health program interface, where people can call, residents can call to look for help, mental health help. So that's been certainly helpful for Winchester.
Mhm.
So I must say, having the hospital in town is certainly an asset all around.
Has there ever been any instances where it hasn't felt like much of an asset?
Well, I must say, we were trying to really improve testing, right? And people always need a place to go for testing. And it would be great to have random sampling of the public where they could go, for example, asymptomatic people could go easily. Like the governor has set up those free testing sites.
Right.
However, they're not in Winchester.
Mhm.
They're located in places like Lawrence and Landon. So for some people, it may seem like a burden to get there. So having testing closer to home would certainly be beneficial. And I know Winchester Hospital has offered that, but it's a limited capacity. So seeing that expand would certainly be great if the hospital could do that. And I'm in conversations with them to try to see if they can do that. So we'll see where that leads.
All right, awesome. So I read that there are over 100 vaccines in various stages of development. So how does this translate into getting a vaccine that can be used by Winchester residents both quickly and effectively?
So just to throw it out there, a disclaimer, I'm not involved in anything to do with vaccines, although I would be shipped the vaccine to disseminate to the public once it is developed. So we would certainly be part in that administration of the vaccine once it's developed. But obviously vaccines typically take years of research and testing before they typically reach the public. Given the circumstances of the pandemic, the timeline is being fast-tracked, but it will still be quite some time before a vaccine is ready to distribute, I would imagine, on a local level. But we do have the infrastructure to do that when it is ready, just like we administer flu vaccines. It would be the same model we would use going forward. So, I can't say too much about what's going on at the vaccine development level, but I can say that we are certainly anxious and ready and willing to administer it as soon as it is ready.
Mm-hmm. And how do you believe they will be disseminated throughout the community? Are there certain age brackets that may get it first before others? Are they searching, if you have a certain medical condition, would you get it before somebody else? How do you believe that will be handled?
Right. So I've heard some preliminary discussions at the state level, and again, nobody is saying too much right now, but I would imagine there would be layers to this. Just as with H1N1 vaccine, certain people were vaccinated first. So I would imagine it would be the same thing. And if I had to guess, I would imagine that, healthcare workers would be some of the first people who would receive the vaccine. Obviously, we need to keep our hospitals and healthcare settings functioning. And then I would imagine it would start with the other vulnerable populations first. For example, perhaps the elderly,
Right.
people who are immunocompromised or medically compromised people next. And then, there's still a lot we don't know about how this affects pregnant women and super young children. So, infants. So I think the data is out on that, and I'm sure people are anxious to see if that's included, as they typically are, in the pool of people who are vulnerable.
Right.
So, and then it would be, the healthy people, everyone else who is under 65, not seemingly healthy all around. So those would be probably some of the last folks who would get the vaccine. So, but again, there's still a lot we don't know about that.
Mm-hmm.
So
Right.
I'm waiting just like everyone else to find out.
All right. Yeah, so how has Winchester approached COVID compared to other neighboring towns? And by any chance, has the Middlesex County, have all the towns within the Middlesex County coordinated efforts?
So our approaches with neighboring towns have been very similar, but not always identical due to the variation in population sizes and demographics. For example, Winchester is not a Woburn, it's not a Medford or a Malden. However, I do collaborate with those communities and my colleagues, just because a lot of the same things that we have developed hold true in every community in terms of prevention strategies. Like early on, we thought of closing personal services like hair salons and nail salons. And we were thinking of that as a region versus, just an independent town doing that. So while no formal alliances have been made, there have been subgroups of health directors, as I was saying, in Middlesex County where we coordinate efforts and share ideas. So that's been very helpful. We came together, and as I said, we did ban those personal services as a group in our individual towns well ahead of when the state did that. So
Right.
having that strength in numbers was helpful. And also easier for the public and the surrounding communities to understand better, to communicate that. We've also collaborated informally with health directors outside of Middlesex County as well on best practices and lessons learned, just as we did prior to COVID. So that is held true through COVID as well.
Sure, sure. So would you like to share information about COVID initiatives that you'd like our residents to know about? And feel free to talk about both the challenges and victories.
Sure. So let's see. The mask mandate, that was something that the town created ahead of the state months ago, so that in certain places, people were required to wear a mask indoors. So talking about wearing a mask or a face covering over your mouth and nose, as most people are quite familiar with now, but weren't necessarily months ago. So we required that they be worn indoors in public places, for example, in stores like restaurants. When you could go in to get takeout, you had to wear a face covering. And then outdoors, we required it at the transfer station, which was a heavily populated area in town, as people who use it know. And so it seemed that it was necessary to take that measure and require face coverings there as well. We did a mask drive for our senior population. In other words, it was a drive-through pickup mask event, which was well attended. And so that was great. And if needed, we could do that again as well. It seems like a lot of people have had supply since then, but at the outset, people did not have access to masks. And making a face covering initially seemed like a daunting task, especially for our senior population. So we helped them out with the mask drive-through pickup. And we're working on a mask zone and an educational program downtown right now. As you know, the governor's order says that when you're outdoors and you can't maintain more than 6 feet from people, you need to wear a mask. So we're hoping to reinforce that idea by having people downtown who represent the town say, remind people, and also hand out masks if folks don't have them down there. So we're just trying to keep each other healthy through that educational strategy right now. Let's see, in terms of risk communication, the health department develops and shares communication with a focus on how to limit COVID transmission within the community and protect our most vulnerable populations. Outreach is conducted to inform the general public, businesses, and high-risk sectors of our community. We use several channels to do risk communication. For example, we use social media. The town has a Facebook page as well as a Twitter account. We also can use our reverse 911 system, which is a phone call, that message that we can send out in a blast to many, many people. It's been very effective. So when we have an urgent message, we do use that system as well. And then we have our home, our website, our town website rather, that people can go to. And we've loaded it with a lot of information, but you know, it's a menu. So you can select the topic about COVID, what you want to know, and go directly to that page. So we've really honed our risk communication techniques and our messages over time. One thing that we do is contact tracing and quarantining of people. I don't know. That's sort of the foundation of what we do for COVID. We receive test results for people in the community, and if people are positive, we conduct surveillance. It's called disease surveillance, like we would do with anything, like a measles case or a TB case. And so the same principles hold true for COVID, because what we want to do is identify the people who are positive in town, reach out, conduct an interview, find out who may have been exposed through their activities, and then do what's called the contact tracing. And so that requires a level of cooperation with the health department. And most people overall have been quite cooperative in helping us, because it really does contain the spread. You know, once you have an active case, you really need to do that outreach and identify others who are exposed, who have risk of developing the disease. So at the foundation, really, of everything, at the basis of what we do, contact tracing and case identification really is key to all this. And we have a great team right now led by our public health nurse, Kathy Whitaker, and she has several nurses working for her who do this work and make that effort to keep people safe in town. So, but again, it's a cooperative effort, and if people receive a phone call from us, we really do ask that they view it as a chance for them to help stop the spread or stop the potential spread of the virus. So it's key. Some of the policies and guidance, the Board of Health and Select Board members voted to declare a public health emergency early on at the outset of COVID, and adopted several orders to be protective of our residents and stop the spread. And those were joint efforts between the Board of Health and the Select Board, and our town officials worked extremely well together and understood early on the importance of taking those actions. And while, taking some actions like a mask mandate ahead of the state, it was disruptive, and there was initial pushback from the community, we heard, but I think that people understood the severity of the situation enough to want to comply with that. The health department also advocated early on for universal screening and testing at nursing homes, which proved to be, as I said earlier on, a bit of a challenge. But in the end, once it was actually done by the state, it proved to be beneficial.
Right.
And so, yeah.
So in Winchester, as in other towns, how to effectively reopen schools has been a very significant challenge. So I know that WHS specifically has taken several precautionary measures to safely welcome students back. But as a medical administrator, I was curious what your thoughts were on this situation.
Right. And so we've implemented, I think as a town, we've implemented every safety precaution that has been recommended from the state level as well as the CDC. We have at the state level, we have the Department of Public Health, and then we have DESE, or the Department of Secondary Education, that have both given local officials much guidance and many recommendations. And Winchester, through the leadership of the superintendent, Dr. Evans, has certainly abided by and complied with those directives to ensure a safe return to school through the hybrid model. And so, it's great that students can go back, and we're trying to make it a safe environment as possible. We've communicated ahead of time to have students and parents prepare for school. And the superintendent, I think, has done a good job making that very clear, what those recommendations are that parents should and students should abide by, and what the expectation is going back to school. And we recognize that quarantining will be disruptive to the learning process, but it's a trade-off to being in school in person, as well as other things like wearing masks and staying 6 feet apart. So, that social distancing and hand hygiene and all that. But certainly the quarantining, for example, if people feel sick, they shouldn't go to school, right? And that's the underlying message for everything, I think, is if you feel any of the COVID-like symptoms, be sure you stay home. We strongly recommend people get a COVID test. Again, it's free right now through the governor's mandate, and people can go to those testing sites for free testing. The PCR test, again, is the most crucial test to get. And also, if we call and are doing the contact tracing that I mentioned earlier on, to answer the call, to be cooperative, and most importantly, to abide by the instructions given, whether it be to, if you're a case, to isolate at home, or if you're a close contact, to quarantine at home for a certain amount of time. Again, that level of cooperation is so key to all of this. So cooperation, yeah, is my message of the day, I guess.
Yeah, no, and I couldn't agree more, because we have to work on this as a community, and and cooperating obviously is part of that. So hindsight being 2020, is there anything that you would have liked the town to do differently? I know you talked briefly about some of the federal issues that you saw, but specifically for Winchester, what do you think we should have done?
Yeah, so I would say that the town as a whole was proactive and very willing to take measures that were necessary, even though they may have seemed initially drastic to some.
Mhm.
Um, they saw, the town saw the necessity in that. And I do give us credit as well for closing the schools ahead of the state. We did that a week ahead, and we saw the necessity in that as well. So I, what could we have done differently? I really have to say, I think we're lucky. Winchester is very lucky to have town officials who see the importance and the severity of COVID. So I don't have I don't have regrets, I must say, and I don't think that necessarily we should have done things differently. I think Winchester was in um, a spot to benefit from the early decisions and actions that we took, quite honestly.
And I think that's the answer all the residents want to hear. So that's awesome.
Yeah, and I'm not saying that to make friends. I
Oh,
really do feel
no, no,
that
no.
we,
Yeah, yeah. No, yeah, that's what I mean. Because I agree that we've handled this pandemic very well, especially compared to certain neighboring towns and stuff of that nature. And I think what's really impressive is that how we took initiative even before the states in multiple instances to protect our town. And it really shows with the very small amount of COVID cases we have. I believe it's only maybe one or two, which is pretty.
yeah, our numbers were very low compared, you're right. Our numbers have always remained very low comparatively if you look at other bordering towns and communities. And so, yeah, thank you for pointing that out and reminding everyone that it's through everyone's actions, whether it be the residents who were able to work from home quickly and go into sort of a quote lockdown mode, or if it were the town officials that closed school early on to prevent transmission. So yeah, you're right. Our actions have certainly have resulted in the low numbers. So it's borne out in the numbers. You're right.
Yeah. Now, do you have any parting thoughts you'd like to add before saying goodbye?
And thank you for the interview, by the way. This has been fun. It's out of the ordinary for me, and I love that. So I would just say that in order for schools to be successful, everyone needs to do their part. Parents and students need to, everyone needs to take responsibility and ownership and to help keep our numbers low, as we were just talking about. But it's got to be a sustained effort by everyone. Winchester's a great community, and decisions and actions we take now can impact the health and wellness of our entire community.
Mhm.
So those are my parting thoughts.
I couldn't agree more with them. So I unfortunately now have to say goodbye. Thank you so much for being here, Ms. Murphy. I know you're really busy, so I really appreciate you taking the time out of your day to speak with me. I hope you have a fantastic afternoon, and thank you.
Thank you, and good luck for your project. It's been fun.
Thank you so much.